Ever felt like you've literally been in a Mortal Kombat match with your back screaming "Finish him" after a gaming session? Perhaps you've tried to dodge a blue shell in Mario Kart and felt a twinge in your neck, shoulder, or elbow. Or maybe you've attempted executing a perfect Hadouken in Street Fighter only to be rewarded with cramped fingers and throbbing wrist pain. Not the best nor the most enjoyable gaming experience, right? Do you ever wonder why your neck and back feel sore and have pain in your shoulders and elbows after an extended gaming marathon? Or why your fingers feel tense and wrist hurts after rigorous button tapping? It's not just your imagination, it's a reality that gamers, both casual and professional, frequently encounter physical issues. Neck, back, shoulder, elbow, wrist, and finger pain, along with eye discomfort, are common complaints, often resulting from countless hours spent in front of a screen. These issues may seem minor, like a mere annoyance that comes with the territory, but they can have a major impact on your gaming performance and overall quality of life. While gaming can be a fun and engaging activity, it also brings along some serious health risks that can produce a domino effect if not managed mindfully. These risks often go unnoticed, like a stealth assassin lurking in the shadows until they strike. The most significant impact with prolonged gaming sessions begins with change in behavior. This is the #1 health risk on our list, and it is known as a sedentary lifestyle. This type of lifestyle involves little to no physical activity and is a silent adversary. It is the most common initial trigger that can set off a negative chain reaction to your overall health. Next up is #2, obesity. Decreased physical activity is a key contributor to the global epidemic. Obesity is excessive body fat with a body mass index or BMI of 30 or higher in adults. This chronic, complex disease can further impair your health, increasing your risks for other conditions. Moving on to #3, cardiovascular diseases known as CVDs. Having more body fat increases the risk for CVDs, which are a class of diseases that involve the heart or blood vessels. Let's begin with the first two most common CVDs, heart attack and stroke. Please be aware, these two conditions are life-threatening emergencies. If you or someone near you experience any signs and symptoms, call 911 immediately. Heart attacks or myocardial infarctions are caused due to an interruption of blood supply to the heart. Without sufficient blood flow, the heart muscles may become damaged and begin to die, resulting in the possibility of irreversible damage to the heart's tissues. Heart attack symptoms may include chest, arm, shoulder, jaw, or back pain or discomfort, lightheadedness, nausea or vomiting, and shortness of breath. A stroke, specifically an ischemic stroke, happens when a part of your brain doesn't receive adequate blood flow. Without a steady supply of blood, the brain cells in that area start to die from a lack of oxygen. Common signs and symptoms of an ischemic stroke include loss of balance, blurred vision, face drooping, one-sided arm or leg weakness, and speech difficulty. The severely reduced or blockage of blood flow in the arteries that causes both heart attack and an ischemic stroke is often due to a buildup of fatty deposits called plaque. The process of plaque buildup inside the arteries is called atherosclerosis, the third most common CVD. It is mostly associated with high cholesterol and triglyceride levels. The fourth common CVD is blood clots, and there are two types that prevent blood flow, starting with deep vein thrombosis or DVT. This type of blood clot occurs when a blood clot forms partially or completely blocking blood flow in one or more veins, usually in the legs. For gamers, this can develop especially if you don't move for a long period of time. Symptoms can include leg pain, warmth, swelling, tenderness, and redness. The other blood clot is a pulmonary embolism or PE. The blood vessels that send blood to your lungs are pulmonary arteries that become blocked. PE usually occurs when a blood clot from a deep vein in your leg breaks off and travels to your lungs. This can be a life-threatening condition requiring a trip to the emergency room for a quick diagnosis and treatment. Symptoms are sudden shortness of breath, chest pain worsening with breathing, dizziness, lightheadedness, fainting, irregular heartbeat, palpitations, and sweating. #4 is high blood pressure known as hypertension. As previously mentioned, inactivity contributes to hardening and plaque buildup in the arteries. When this happens, the arteries become stiff and narrow, resulting in the heart working harder to circulate blood throughout the body, consequently raising your blood pressure. As you lose yourself in the virtual world, your physical activity decreases, creating a perfect milieu for these health risks. Consider it as a boss battle against your own body, where the adversary is inactivity. Moving on to #5, incorrect posture. Your posture while gaming is crucial. The way you sit, the angle at which you hold your controller or keyboard, It matters more than most realize. Poor posture during gaming can cause a myriad of complications to your health, such as number 6, chronic lower back pain. Sitting for prolonged periods of time with poor posture can cause increased stress on the lumbar spine known as lordosis, affecting your lower back. Lumbar lordosis, also known as swayback, is an excessive inward curve of the lower spine resulting in an exaggerated standing posture, with the buttocks sticking further out to the back than normal, and the stomach pushed forward. Coming up is number 7, upper back pain. This occurs mainly from poor posture such as slouching, which will eventually lead to rounded shoulders resulting in a forward head posture known as kyphosis. Kyphosis is an excessive outward curvature of your upper back or thoracic spine. This condition can cause you to lean forward like you're hunching over with an appearance of a curve or hump in your upper back. Common symptoms of kyphosis are upper back pain and stiffness, fatigue, difficulty breathing, and shortness of breath. Number 8 is chronic neck strain. This condition also occurs from poor posture. Chronic neck strain is a persistent aching or stiffness due to overusing your neck muscles during repetitive activities, which results in pain that often worsens from holding the head in one place for long periods of time. You may also experience muscle tightness and spasms in your neck, decrease ability moving your head, and headaches. Next in line is number 9, frozen shoulder, also known as adhesive capsulitis, a condition where one experiences ongoing shoulder pain in the joint and may feel tight and stiff due to stress, muscle tension, and overuse. Tight shoulders can also be caused by sitting for extended periods, incorrect sleeping positions, and injuries. Once again, poor posture and improper alignment of your body can also play a part in shoulder pain. Moving along to number 10, a common condition known as lateral epicondylitis, or should I say gamer's mouse elbow. This condition is also widely known as tennis elbow and is mainly caused by overuse and repetitive motions of the extensor carpi radialis brevis muscle. This muscle is part of the posterior forearm muscles that bend your wrist and fingers backward away from your palm, and the tendons of these muscles attach to the bone on the outside of the elbow. Even if you have never been on the tennis court, you can still develop this stress injury playing video games. Gamer's mouse elbow is overuse of a computer mouse, particularly in PC gamers. Repetitive finger motion, frequent wrist extension, or when the wrist is extended while using a mouse for long periods of time, can strain the posterior forearm muscles, causing tearing of the tendons. As a result, you are likely to develop pain and tenderness in the lateral epicondyle area when you bend or straighten your arm. Other signs and symptoms include pain and weakness when squeezing your hand, numbness or tingling in your fingers, and your elbow could have redness, swelling, or feel warm. It's like a slow poison, seeping into you bit by bit, round after round. Then there's the issue of screen time, bringing us to number 11, eye strain. Excessive amounts of looking at your screen can induce digital eye strain. Eye strain is fatigue and pain from the muscles in and around your eyes due to overworking your eye muscles. It occurs when you continually contract these muscles during a lengthy gaming session. Other common signs and symptoms can include irritated dry eyes, blurred and double vision, stinging or burning, sensitivity to light, straining nighttime vision, and redness. Consequently, spending long hours staring at a screen while in a gaming chair, often with poor posture, ultimately leads to cervicogenic headaches. Number 12 on our list. Cervicogenic headaches are commonly seen with gamers, and it develops primarily due to prolonged positions and stress on the tissue and joints in the neck. Those who have pain or stiffness in the neck could experience this type of headache. Cervicogenic headaches are usually felt on one side, with a feeling of a dull ache in the neck, head, or face. It can worsen with neck movements or pressing on tender neck muscles known as trigger points. It's akin to being hit by a flashbang in a first-person shooter, leaving you disoriented and at a major disadvantage. Number 13 is carpal tunnel syndrome, or CTS. The repetitive motions involved in gaming, such as the constant button mashing and the joystick movements, may seem harmless but can lead to CTS. It's a common painful condition that occurs when the median nerve is compressed or pinched in the wrist, resulting in numbness, tingling, and weakness in your hand. The median nerve provides sensation from the thumb to the ring finger and runs from the forearm through a passageway in the anterior wrist into the palm of your hand. For gamers, CTS occurs when the wrist is held in extension for long periods of time, when the wrists are bent backwards on the edge of a keyboard, or using a game controller with repetitive and rapid movements of the fingers, wrists, and forearms. It's like a debuff that reduces your dexterity and agility, impacting your performance negatively. Symptoms of CTS can include weakness gripping objects, pain and numbness in the hand that worsens at night, and feeling the sensations of pins, needles, burning, and tingling, along with swelling in the thumb, index, and middle fingers. Last on our list is number 14, de Quervain's tenosynovitis, also called gamer's thumb. Excessive thumb movement is the leading cause of this painful condition. Gamer's thumb is a tenosynovitis that causes irritation and degeneration of the abductor, pollicis longus and extensor pollicis brevis muscle tendon sheaths. These muscles allow the thumb to pull away from the hand and palm backwards and sideways. The tendons of these muscles go through a tunnel alongside of the highly mobile wrist joint and attach to the base of the thumb. With gamer's thumb, this tunnel becomes thickened, creating a narrow and obstructing space that prevents smooth movement of the tendons. This directly causes inflammation of the sheath, which is a thin tissue that lubricates and allows the tendons to move smoothly. This condition is caused by an increase of rapid repetitive lifting of your thumb with the wrist in a flexed position. This excessive stress and pressure on the thumb muscles and tendons leads to pain and inflammation, causing decreased mobility. Gamer's thumb is primarily seen in console gaming due to thumb joystick movements and less common for PC gamers. Symptoms include swelling and pain at the base of the thumb, difficulty grasping and pinching, pain turning and flexing the wrist, and making a fist. Now that we went through the top 14 health risks and dangers of gaming, it's time to add a bit more to the list. Yes, you heard that right. Prolonged gaming can also result in decreased hand-eye coordination, reduced endurance, slower reaction time, and impaired movements. But fear not, fellow gamers. The goal here is not to rain on your gaming parade, just to keep you healthy while you're at it. As we dug deeper into the realm of gaming, it is clear that the risks involved can be quite daunting. Nevertheless, there is a powerful weapon in our arsenal to combat these issues: physical therapy. Now you might be asking, how can physical therapy help me as a gamer? Physical therapy, often referred to as PT, is a healthcare profession dedicated to restoring and maintaining physical function and body movement. It's about understanding the body's mechanics and, most importantly, respecting its limits. PT does not just help in the recovery process after an injury. It can also be a preventive measure to avoid potential physical impairments from prolonged gaming. It can help you maintain a healthy posture, reducing the risk of chronic back and neck pain. It can also improve your physical endurance, allowing you to keep up with the demands of your favorite games without feeling fatigued. PT exercises can strengthen your hand and wrist muscles, and as an added bonus, PT can also help enhance hand-eye coordination. This can significantly improve your in-game performance, making you more competitive and efficient in your gameplay. So don't let the health risks of gaming get you down. In this case, physical therapy can be your secret weapon, bridging the gap between gaming and health. And that, gamers, wraps up part 1 of our series. Always bear in mind, your health is your most precious asset. After all, the best gamers aren't just those with the fastest reflexes or the sharpest strategies, but those who prioritize their physical well-being too. So, gear up to level up your game with physical therapy in part 2 with specific tips, exercises, and strategies, and witness the transformation it can bring. And remember, in gaming as in life, your health is always the ultimate high score. Until then, keep gaming and stay safe.
Be sure to like, comment, and subscribe to watch more of Dr. Yaz's PT videos.